Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane with the Ask Dr. Pane segment, where Dr. Pane will answer your questions live on the air. This week's question comes from Twitter, and Dr. Pane, they're asking, they need help with shifting around their tummy fat. Apparently, they have excessive fat around their belly. She's not stressed out, so it's not from cortisol or being stressed. They eat healthy and exercise four to five times a week. They can't lose a flab, and they kind of want to know what are their options at this point, and what do you suggest, Dr. Pane?
And when I looked at these photos, this was somebody that has no history of weight gain or loss and no kids. And the skin is overall pretty good. There also isn't a lot of intra-abdominal or inside the abdomen fat. Now, I know that they're not a fan of liposuction, but realistically, that's probably going to be the best option here because the skin is good and there's no real looseness of it where it needs to be excised or anything. And they don't have a lot of fat that isn't accessible, say, inside where the organs are. So in this case, lipo is going to be the best option. But if they don't want to do that, which is okay, they might want to consider some other options. They've already said that diet and exercise has been tried. Then they might want to meet with a registered dietitian or something and go over real details as to what can be done. And if they're willing to commit to that very strongly, they may be able to shape these areas better. But it's what we call lipodystrophy. So that's when fat is in slightly weird places, and that's what liposuction is best for. It's not a weight loss procedure. It's not something that's great when there's loose skin. But somebody like this has actually got the for it, but you have to want to be able to do it. And it may be worthwhile to check out some of the other options and see. I'm not a huge fan of the non-invasive methods of dealing with fat because even though you see a lot of that with the marketing, we haven't found a way to replace liposuction. So somebody like this is probably going to see limited benefit from that. They may want to try it, and if they're okay, with maybe seeing minimal results or not really the greatest results, it's certainly worth a try because it's not surgery. But that's how I would look at this case. So liposuction, if interested, or maybe working with a dietitian, and the non-invasive methods probably as the third string. Want to try it and see how it works out, and they're okay with the cost involved in that if there's not a lot of result. So that's how I would handle it here.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our Facebook page, website, LinkedIn, or Twitter. And Dr. Pane, we'll see you on the next question.
Very good.